Hi, everybody. I'm going to remove the 2 minutes to start. Well, thanks for coming in tonight. It's a big night for politics, I guess. Thanks for coming to this address here this evening. And then I hope some of you will watch the first presidential debate, get a sense of Joe Biden and Donald Trump one-on-one, talking not too far from here over in Cleveland. I want to thank Jason is with us here tonight, but he is backstage doing the stuff, so you'll only get to look at my face this evening. So as you may know, or many of you do know, my name's Matt Ferentz, and I'm running for the Pennsylvania House of Representatives to be your next representative in Harrisburg. I'm going to open with a story this evening because the topic is healthcare. And healthcare, at the end of the day, is something very personal. It's not political, or at least it shouldn't be political. When we're talking about healthcare, what we're really talking about is you and how you feel today and tomorrow and 10 years from now. We're talking about your elderly parents, your young kids, and unfortunately about how all of us have been denied the right to a secure protection of our health because of politics. To the story. As I rolled through my 30s, I started to notice something odd about my vision. Things just never seemed crisp, and even after getting new glasses, it always seemed that something was just a touch off in my left eye. I asked several optometrists about this at annual checkups, and everything always measured out fine, clinically. So more or less the diagnosis was you're getting older, so I carried on. In the summer of 2015, I realized while reading Calvin and Hobbes to my then 6-year-old, I could do a strange trick. By closing my right eye, I could make Calvin's head disappear. Poof, gone. Something clearly wasn't right. But all stories have complications, and this is mine. My employer-sponsored healthcare had recently moved into a high deductible model for cost savings measures. And that meant for each and every visit, we had to pay out of pocket until we reached what seemed to be a totally distant $3,000 first out-of-pocket threshold. At that point, we would pay 10% of further health care until we reached the next $3,000. Many of you know how this works, and you know that we and me and you, all of us, also pay a not insignificant monthly premium on top of those deductibles in order to have that insurance. So, of course, in my case, I waited because I'd been told my vision was fine, and mostly because I knew a specialist would be expensive. Our family budget is tight every month, like most of us. So, sure, if things were fine, I was just getting older. That winter, as it turned out, my wife wound up having some expensive tests, and that put us close enough to the deductible threshold that I decided to splurge. It's a weird word here, but to splurge on my health and see an eye specialist. Within about a week, I was meeting with a brain surgeon in Pittsburgh, talking about the tumor that had been found on an MRI taken just in case, and how that tumor was growing on the lining of my brain and was pushing against my optic nerve and had caused the blind spot that made Calvin's head disappear when I read to my then 6-year-old. So in March of 2016, just a couple weeks after that son turned 7, and after our other son turned 3, I faced an all-day brain surgery and a hard multi-month recovery, and 6 weeks of daily radiation zaps in my brain, permanent side effects, and a perpetual sense of myself as not invincible. Or as they say in politics and insurance boardrooms, as a person with a pre-existing condition who could lose the ability to find health insurance on the open market if some of what's happening in Washington continues to happen. I also became a person who experienced firsthand how a medical issue can wreak permanent financial havoc on an American's pocketbook. That high deductible, well, we met it, of course, in 2016 and the next $3,000 deductible, and wound up having to find the cash to pay something like 20% of our annual household salary to cover treatments. That meant credit card roulette. because I am one of the lucky ones with good enough credit to get new cards in which we could run up those balances, and because we have what counts as good health insurance these days, even if financially it's not so good. And I should mention as well, remember, I wouldn't have even gotten checked out if we hadn't met the deductible. If I had not had health insurance, my treatments would have cost about $200,000 out of pocket, and we would be bankrupt. Or I would have rolled the dice and hoped my slow-growing tumor grew slowly enough that I could save up enough money to pay for treatment. Or I could have turned to one of America's major sources of healthcare funding, a GoFundMe campaign. Flat out, this is wrong, cruel, ridiculous for a nation as wealthy as the US, and completely avoidable. We know this. We know America is one of the only developed nations without universal single-payer healthcare, which is different than socialized medicine, universal single-payer healthcare. And we know, though sometimes we look away from this, that compared to its peers, the US spends the most on healthcare and ranks at or near the bottom every year in health outcomes. We pay more and we get less. And this is the system we have refused to fix. When we've tried, politicians have crowed about the merits of capitalist competition in the marketplace, then undermined legislative solutions to a healthcare crisis in America. One of the main reasons I am running for public office is because of my brain surgery. I want to be a part of the solution to this problem, and I have no faith in the politicians we elect over and over who take buckets of donations from insurance companies, who have even sat on the PA House Healthcare Committee and done nothing to fix this fixable problem. An illustrative legislative history. In 2014, Brad Roy voted against Medicaid expansion that would have helped lower-income Pennsylvanians have access to health insurance. And Brad Roy represents Erie and Crawford counties where the poverty rate is 13%, higher than the state average. And Brad Roy represents Meadville, which has a poverty rate of 24%, twice the state average. And Brad Roy has voted against Medicaid repeatedly, making it harder for folks to qualify in a district where so many people need it. There has been a proposed solution. In every session for a decade, the Healthcare for All bill has been submitted and died in committee. A bill like it would radically positively transform the healthcare landscape in Pennsylvania. In the bill, workers would pay 3% of their wages for healthcare. That means 80% of workers in the Commonwealth would pay less for this healthcare, and an even greater percentage would pay less here in northwestern PA. And the coverage they get would be superior to what they currently have. The bill offers expanded high-quality doctor choice healthcare for everybody, and it would not be tied to an employer. And that's an important point we'll get back to. Under this plan, employers would pay 10% of their payroll, which would be a direct reduction of cost for most, and particularly for those who understand the ethical importance of offering coverage for their employees. Many would experience further savings in retiree healthcare costs and COBRA. Public entities like school districts, county governments, would in many cases reduce their healthcare costs from 20% of payroll to 10% of payroll, saving money for themselves, and here's an important point, for the taxpayer. Let me put this in real person dollars. Right now, my family pays more than $7,000 a year for healthcare. Between baseline premiums and the deductible we now hit every year, thanks brain tumor, plus my employer pitches in another $14,000. Under this bill, our personal family cost would drop to a bit more than $2,000, a savings of $5,000, and my employer would save about $7,000. My coverage would be more comprehensive. Here's another sidelight we have to consider. No employer is really paying for your health care because those benefits costs really are coming out of your total compensation package. We've been trained to feel grateful to employers for giving us healthcare when in fact we're still paying for it. Even if we aren't paying for it directly out of our pocket, it's still coming out of our total compensation. So to recap the high points here, number one, better healthcare for less. Two, lower costs for workers and most employers, plus savings that employers could or should come back to their workers as increased wages. Three, coverage for everyone, which is the right thing to do. Four, lower cost for tax-supported entities like school districts, which means a Commonwealth-managed healthcare plan would save tax dollars. Five, no one has to stay in a bad job because it gives them healthcare. So why all the opposition? That is a really good question. Opposition item number one is control. I think a major obstacle to universal health care is corporate control. Big corporations don't want to separate healthcare from employment because big corporations want to use your life as the incentive to work for them. They don't want people to quit a job that treats them poorly. They don't want small businesses to be able to compete with larger companies on a level playing field. Big companies want to be able to offer benefits packages that mom and pop enterprises can't afford so they can corner markets. And the corporate profit mindset wants to be able to use your health as their competitive advantage. Because this is the big thing opponents of single-payer healthcare like to roll out. Let the market decide. Competition. That's gross. Because the competition is about your health. You are the negotiable commodity in the equation. And beyond all else, we should not be viewing the human right to healthcare as a commodity to be bought and sold for someone else's profit. A single-payer system is good for business, for small business, because those employees will have health care and because it would relieve significant payroll costs for those employers who are currently offering it. Some smaller businesses can't even afford to give their employees health care right now because of the cost of entry, and a manageable 10% would let them do right by their workers, which most employers want to do. Big companies, it seems, would rather pay more for health care because it is the cost of keeping away the competition, which again means you and I are the commodity. Opposition item number two, those dang taxes. Taxes bad. Well, we already pay a massive unrepresented tax in healthcare. We just pay it to health insurance companies who are not elected. They are not accountable to us. We cannot compete because the marketplace is not competitive and they are not elected. And again, can you opt out? You can't because you're rolling the dice with your life. Think about my personal example. Yes, our taxes would go up by $2,000, but our costs would reduce by at least $5,000. I know it's counterintuitive, but sometimes taxes are a way to save money because taxes are the pooled resources of everybody keeping costs down. Otherwise, it's just the wealthiest who can afford whatever they want, and the rest of us just getting whatever we get. Opposition item number three, Canada. You've heard that one, how awful coverage is for Canadians. I'd wager that most people who say such things don't actually know many Canadians well enough to talk about their feelings about their national healthcare system. I do know a lot of Canadians, as it turns out, and they don't experience the sort of awful wait times politicians like to pretend exist. And in fact, Canadians are awfully proud of their system. Plus, the Canadians I know, many of whom live in places with struggling economies like ours, when they lose jobs, and they do, the one thing they never have to worry about is how they'll pay for their health care. I think we all see and understand right now how necessary healthcare free from employer sponsorship happens to be. Lots of people lost jobs in Pennsylvania due to the combined health and economic impact of COVID. Unfortunately, because our system is broken, lots of people also lost health coverage. Opposition item number four, doctors. Well, you can still choose your doctor in a plan like healthcare or Health for All PA, and doctors are not employees of the state. The state is the insurance company. And if you actually talk to doctors about the things that make their work harder, Dealing with insurance companies is at the top of the list. Pre-certifications for procedures, which make the insurance companies the arbiters of what treatment happens. Ridiculous volumes of paperwork because every insurer does it differently. Having to spend half their time on insurance, which leads to job burnout, because you don't become a doctor to fight with insurance companies. You do it to care for patients. Another brief story. One of my very best friends in the world left private practice as a primary care physician to become the director at a free clinic in North Carolina. She tells me that one of the largest demographics represented in her clientele is women who have had to break away from bad partners and in so doing have lost health insurance. Think about that. How many people are stuck in abusive relationships because they're stuck in their abusive partner's employer-sponsored health care? Or how many people leave, then have to worry every day about getting sick? Single-payer insurance gives people the freedom to leave that bad relationship without the additional stress of wondering what happens if they fall ill. Opposition item 5, bad faith. That's a big one. And we've seen it over and over. Politicians who care so much more about corporate profit lines than the people they claim to represent, who demonstrate wanton disregard for public health, whether that's in denying the reality of COVID or denying the necessity of providing health care for everyone. Such opposition reveals the depth of ideological bad faith that certain strains of politician are so deeply invested in a governance of cruelty and disregard that they can't even see how compassion is both right and, the kicker, more cost effective. Because we know a lot of the cost of healthcare in dollars and human experience comes from the accumulated effect of people who don't have it. From people who can't afford coverage or a specialist visit and, like me, put it off, and the permanent blind spot in their eye gets bigger, or their cancer grows undetected, or their diabetes gets out of control, or their autoimmune disorder goes undiagnosed, on and on. That costs us all a lot. And we'd be in a better spot if we recognize what almost every other country in the world has. Healthcare is good for the economy, for national security, and come on, is just the right thing to do. Now, I'm running for the State House of Representatives, so you might be asking yourself, isn't this a federal issue? And I'm going to have to say, no, it's not. Partly because we have seen how intractable the politics are there, and also because we have an opportunity to get ahead of the curve on healthcare here in Pennsylvania. We can be leaders. Our population and economy is big enough, 13 million people, or about the size of Belgium, which has universal health care, or 3 times the size of Norway, which has universal health care, or almost 4 times the size of New Zealand, which has universal health care. I think you get the point. We are big enough to do this. And think of the benefits to our economy and otherwise. Well-controlled, lower-cost health care would be a draw for companies to come to Pennsylvania. They could balance their books more easily. Some of you might start your own business because you wouldn't have to worry about exorbitant healthcare costs. Some of you might leave a job that treats you poorly, tell them to stuff it, and not have to worry about healthcare. Some of you could get out of relationships you desperately need to get out of. Some of you might finally be able to afford to start a family, become an artist, afford a home, invent something we don't even know we need yet. For us, in a lower income part of the state, how life-changing would it be to have this kind of health care? I truly believe this is why opponents to single payer don't want it, because it guarantees liberty and freedom for everyone, regardless of wage, race, gender, sexuality, or religious belief. And for those of us who live in a part of the state whose economy has been collapsed by industrial abandonment, who are ready to reinvent the region in a better, brighter, more equitable way, to focus on living here, single-payer healthcare could be a game changer for us and for our economy. But again and again, we see how we live in an economy and with representation that seems designed to keep us struggling, so we'll accept bad deals and exploitative deals and turn on each other and nothing gets better. I think it can. I think we can be a commonwealth of care. We can afford it, we must afford it, We deserve to be able to live our lives free of the fear of medical bankruptcy or of getting sick and being unable to pay for care. We owe it to ourselves and to everyone to refuse the same bad, empty deals we keep getting. We owe it to ourselves and to everyone to demand better of our elected officials. Please consider voting for me on November 3rd as part of making that demand. So we'll open it up to some questions that we have. Jason's going to throw them up on the feed, and I'll probably read them out loud and answer a little bit apart from our different situation. So Glenn's question, which you can read, but I'll read it out loud because that helps my ears. Would small businesses be hurt? Would it reduce cost to businesses and citizens? How would it be paid? I mean, to reiterate, yeah, I think this would help small businesses because the cost is going to go down. A small business owner is either praying they don't hurt themselves or they're paying quite a lot for healthcare that's not in a large marketplace. With a 3% employee and a 10% employer share, that should be a very affordable rate for most small businesses to gain entry. And I think, again, the big point I want to emphasize is that if you're looking for a job doing the same thing at the same pay, one of the differentials can be the benefits or the healthcare. A large company can offset that cost because they have the bigger pool. And so the privatized model of effectively for-profit healthcare, even though it's run by nonprofits in a lot of parts of the country, the effect of that is to give an unfair competitive advantage to the large multinational corporation and make it harder for small businesses to afford it. I've actually honestly never understood why single-payer healthcare is not a major Republican priority, because it would be of tremendous help to the small business community. So Adam Olin, just as we have public and private education, we should have both options for healthcare. You know, I think that this is probably true, and I would say that it would be the same as public and private education. We need to guarantee that we have the baseline of high quality public access for education and for healthcare, and then there are private options, but those become either secondary insurance. This is something a lot of other countries have, is that there is a high quality baseline that is the public that everybody has, and then there are other incentives for boutique care or more specialized treatments of some kind. And sometimes that can be offered as an additional benefit from an employer, or sometimes it's a buy-in for a person. And I want to emphasize that there's nothing about a single-payer healthcare system that is antithetical to a private medical system. The medical system remains unchanged. It's just who's paying the bills. The big thing is that right now, and if you talk to any physician who's involved in the billing, they're finding it harder and harder almost on a daily basis, because there may be 5 different insurance companies in play for their coverage. So they have to have specialists who know how to file the right claim in the right way with the right codes. That's an enormous inefficiency in the bureaucracy of private health insurance. If we had, and actually I'm going to go somewhere else. I actually don't care if it winds up being a public single payer option. If we can figure this out through a matrix of public companies, I would be fine with that too. For me, it needs to be portable, it needs to be universal, and it needs to be truly affordable. So the public-private part of it winds up not mattering quite as much to me in the end. It's really just that we all have it. The Bismarck model. I will have to defer to your wisdom on that, Glenn. I'll have to look that up. I don't know what the Bismarck model is offhand. I know probably we're all gearing up for the conversation later tonight. Voluntary, I'm not sure to what aspect of voluntary we're talking about. I mean, I think, I don't know if I'm answering the question that you're asking here, Glenn, but one of the disastrous sabotages ultimately of the ACA was that it wound up not having a large enough pool. And that meant that the cost of getting insurances on the exchanges was too high. And so if we think about Switzerland, they have a compulsory private insurance situation for medical insurance. And it's a pretty high cost insurance system comparable to ours, but with much higher outcomes. I don't favor that model because of how much it costs the individual person. And so, I mean, I think, yeah, you need insurance for your car, needing insurance for yourself is probably also necessary. And it doesn't have to be thought of necessarily as a compulsory or not. It just is as it would be. I see the comment that came up down below. I know Jason hasn't put it up about to pay for an unwanted product. My point on healthcare is that it is only an unwanted product until you need it. And that it's very easy for us to see paying for healthcare when we're healthy as being a lot of money for nothing. But the fact of the matter is, at some point in our lives, all of us are going to experience, or at minimum experience, someone in our family with what would be catastrophic health impact if we don't have affordable ways to get it. And so there are certain things that I don't think fit into the competitive model of a product that is desired or not desired. At the end of the day, humans need to live and desire to live. And healthcare is really about that quality of life and maintaining it. Competitive marketplaces work when the consumer has the ability to walk away. And that walking away can either be walking away to a different vendor or just saying, you know what, I don't need a Maserati. I'm not buying it. It's too much money. That's not what we have in healthcare. Another quick story of that. I mean, this is one of the, I think, the distortions that we get. When my employer moved to a high deductible model, there was a healthcare vendor that came in. So this was a different company. And this is how our system works. Big companies hire a middle company to negotiate the healthcare purchases. And when that person talked to us about the benefits of a high deductible plan, the story she told us was of her daughter breaking her arm. And instead of immediately taking her daughter to the hospital, she said the great benefit of a high deductible plan is I could go online and search for all of the medical care facilities in the area and see which one was cheapest and become an informed consumer. My immediate reaction to that is that you are not an informed consumer when you're seeking healthcare, and you shouldn't have to be shopping around for the best price on an ambulance if you're in an accident, or the best price for an MRI if you're in an accident and need something to be seen. That's not a true competitive marketplace. It becomes even worse in rural places like up here, is if you're living in an urban area, there is some shop around effect. There may be multiple hospital systems. When you're in a small town, there's not. You don't really have the option to opt out in the same way. Yeah, and I don't know, I'm responding to, I know people can see it if they're on Facebook. You know, doctors are not really, I don't think they're in a place for, yeah, that's what I was looking to. So doctors can't compete, or shouldn't, don't compete. I don't think medicine is a competitive marketplace in the same way that you're trying to sell a widget and create the same widget. I think the fact of the matter is that we have a physician shortage on one hand, and so we need more physicians. Something strikes me as wrong about thinking about competing for patients through undercutting, or even in some cases the other way, by making yourself so expensive that you can choose to not serve. I'm not accusing any physicians around here of doing this, but it happens in some places, of setting up a model for a doctor's office that prevents lower income people from having high quality care. What we're already seeing is physicians opting out of the insurance system when they can, because it's so ungainly, and beginning these boutique services where people pay 20 grand, 50 grand a year to have a physician on call at all times, and that physician only works with a couple of people. That's only going to exacerbate the physician shortages we already experience in rural Pennsylvania. I know people wind up being uncomfortable with the idea of a large entity being involved in the health insurance game, but I come back to, we already are there, and we have no say on it, because it's just boards of directors of insurance companies, and our employers are just shopping around for the lowest price, which doesn't necessarily give us the best outcome. And outcomes is what we should be talking about with healthcare instead of anything else. And so if you have any further questions about any of this stuff, feel free to shoot me an email, matt@electference.com. I'm happy to continue the conversation. And at the end of any of these conversations, all I really want us to do is really think deeply about the decisions that are made that we seem and are inevitable. And we've lived with this system for a long time, and sometimes it can seem like a stretch to step away from it. But I know a lot of people, and perhaps a lot of you who are here tonight, are ready for it and have recognized the personal and financial strain, let alone some of the kinds of care that are not immediately offered. Mental health care comes to mind here. I was just listening to a story about this the other day, and the fact that there are significant problems in mental health coverage that insurance companies will not pay for treatments until the psychological issue gets to a certain extent. And the analogy that was offered would be like having cancer and going in and being diagnosed with stage 2 cancer, and an insurance company saying, come back when it's stage 4, then we'll do something about it. So what we see is a lot of early stage mental health issues not being covered and people not having the mental health care that they need, which exacerbates the problems. That's the kind of problem that we wind up with if we're not willing to ask these tough questions and find a new way to do it. So thanks for tuning in tonight. Matt@electference.com. That's the email that came up there. I hope you do have an opportunity later this evening to tune in to the presidential debate. Should be an interesting and a good one. More than anything, stay engaged with all the races that will be on your ballot. Your mail-in ballots will be arriving perhaps as soon as this week. They started to go out today and tomorrow in Crawford County. They went out at the end of the week in Erie County. And whether you're voting for the Pennsylvania House or U.S. Congress or the president, make sure you know who you're voting for and what they stand for. Have a good night, and we'll see you later.